Hello, my name is Gerard Gioia, and I am at Children's National Health System in Washington, D.C. This is series number 2. We're going to talk about what we are doing in clinic to assess and treat kids with concussion. The topic of my presentation is on promoting successful return to school following a concussion. And we're going to talk about this as we view how we can improve services to kids over the next 3 to 5 years. So let me tell you a little bit about who I am. I'm a pediatric neuropsychologist. I'm a clinician. I see kids in clinic. I am a researcher, having conducted various studies to try to better understand the effects of mild traumatic brain injury or concussion. I am a teacher and trainer. We actively train pediatric neuropsychologists and graduate students. And I'm also active in the public health world, trying to promote better services more broadly. I also run the Division of Neuropsychology at Children's National Health System and am a professor of pediatrics and psychiatry at the George Washington University School of Medicine. I've been active in the field of traumatic brain injury now for over a quarter of a century and have specialized with mild TBI or concussion over the past 13 years. I'm also a former school psychologist, and my heart very much lives in the schools in terms of how we can better promote kids' performance, their learning, their activity in school. I've worked with the Centers for Disease Control and Prevention now for the past 12 years, particularly in the area of mild TBI. We have received a number of research grants from the CDC, as well as working in the public advocacy and education domain, the Heads Up toolkits that I'll talk a little bit more about as we go through the presentation. And I've worked with many different school systems over the last number of years, really in trying to improve ways that we can return kids to school successfully. And finally, have published a number of papers related to promoting successful school return. So here are the toolkits that we have developed for the CDC and several of the papers that we've published that try to address these issues of promoting return. So let's talk a little bit about what we're currently doing to address concussion in kids. First, I've been working to define the types of school-related problems and concerns that students report following concussion. And so, as I say, we have published a number of different papers. For example, the fact that greater than 70% of middle school and high school students report headaches interfering with learning and performance within 4 weeks of their injury. Having difficulty understanding new learning material, obviously making it a challenge to be a student, and that's happening in almost half of our students. And then concerns, certainly at the high school level, about grades dropping, and we see a third of the students are worried about that. Also been doing some work trying to identify what are the key goals that we really need to be focusing on to assist proper school return. Looking toward, again, training and preparing medical providers and school personnel, having knowledgeable school teams that can translate symptom profiles into active academic support so the kids' needs are being addressed, and also looking to coordinate and better communicate between the players so that kids' needs are supported. We've worked to develop a plan for a gradual return to school, a 6-stage process with recommended activities that kids would do in school and criteria for advancement. We've developed in our CDC Heads Up to Clinicians toolkit the ACE Care Plan, which is a tool just to communicate the students' needs to the school personnel and to families to assist with targeted management. And finally, I've done lots of training of medical providers in the community as well as school personnel. How can we build the proper kinds of partnerships and systems to make this a smooth transition in their return? We also look to promote a more active, positive approach to concussion rehabilitation and management. We have outlined in several papers our 4-stage PACE model, which are the progressive activities of controlled exertion. This helps to frame for the clinician, but also for the school, how to proceed, knowing that we need to be positive about recovery, define what are the demands that might increase symptoms, the activity exertion schedule, and then teach kids how to manage their activities in such a way that they can get through the school day. And finally, making sure that we're reinforcing that there is a positive, progressive pathway to recovery. We want to identify for schools and for families and clinicians, what are the key questions that would facilitate the school return? For example, when's the best time to send someone back to school? What time of the day should they be coming in? How do we do that? When are the symptom hotspots occurring? That is, when do my headaches start to really increase? When do I really start to fatigue in such a way that I can't concentrate? And how do we build in the appropriate symptom management strategies, such as a rest break during those times? We also want to be sure that we reassure and normalize kind of recovery and certain kinds of factors. For example, symptom exacerbation, knowing that that's actually what happens, and how do we manage that? And finally, addressing other kinds of activities in the return to school, such as, when your friends ask you questions, or what teachers should expect. How do you manage the environment? All these things are very, very important that we've been working on. So what's working so far? What we know that we've been translating research into practical methods to define the students' needs. We've been trying to find ways that we can assure that kids are going to have that smooth return. And there's a couple of excellent models currently in place, Pennsylvania, Oregon, and Colorado. And I encourage you to take a look at these different programs. The Brain Steps program that Brenda Eggen-Brown in Pennsylvania has put into place in over 850 schools. It's great. Or the Brain 101 school-wide concussion management program. This is actually an evidence-based model that really looks at how do you educate and implement the support structures and policies. And then in Colorado, the REAP program. Finally, what's working? Active training of healthcare providers and school professionals. We've had some real positive responses to helping people to build their knowledge and their skills in helping kids to return. We are also working to increase recognition of the effects on school performance. And so the American Academy of Pediatrics has put out a position paper 2 years ago talking about this and really raising the awareness more of pediatricians, as well as our Heads Up toolkit, the Heads Up to Schools, Know Your Concussion ABCs, providing some really good practical tools. Recognizing in some of our state laws in the United States that the need to support kids in their return to school. So we're making some strides there. And finally, we have a national pediatric TBI group in the United States called the National Collaborative on Childhood Brain Injury. And we've submitted a paper through that group providing guidance to states to build better infrastructures to support kids with mild TBI and concussion. There are some barriers, though, that we know we've got to face. Schools at this point are they are underprepared, undertrained. They're really not understanding what this concussion invisible injury is all about and how it might manifest in school. Many schools don't have a concussion management team in place to be able to help kids, and there oftentimes is a lack of a champion to guide that process within a school system. And we've tended to focus more on the return to sports rather than the return to school. Healthcare providers can be uncomfortable with their role and their skill set in facilitating school return. We've got to improve that. And there's also challenges in the communication between two very busy systems, the schools and the healthcare. And so our HIPAA, FERPA kinds of regulatory systems are things that can be at times a barrier. Parents and students oftentimes are not clear about what they should even be asking for, how they should be advocating for their active return. And there are competing priorities within schools and the healthcare fields for other important issues. And finally, a lack of availability just of knowledgeable concussion professionals in many communities to actually take on this training process. Lastly, we are still working within the field of concussion to build evidence-based treatment models for managing recovery. And so we've tended to focus on more of a passive rest model for recovery, instead of looking at active reintegration kinds of models. How do we get kids back into school? It's not been a focus. So we've got some barriers that we need to overtake. So what's the call to action? What am I hoping to get out of this symposium? I'm hoping that we're going to develop a strong consensus plan amongst the participants to really develop the evidence base to tailor our most effective strategies for a successful return to school for all students who have sustained a concussion, and to generate a workable strategy for the development of an effective method where we can put widespread training and preparation of our healthcare providers as well as our school system personnel to translate this need of these students into a successful both academic and social emotional return to school as quickly as we can. So in short summary here, what we have are some strategies that we need to move forward now, and I'm looking forward to this international symposium to make that happen.